Schizophrenia is a mental illness that causes patients to have difficulty separating what is real from what is not. They experience issues with their behavior, cognitive skills, mood, etc. The symptoms of this disease have been separated into positive and negative categories, as shown in the chart on screen. One must be diagnosed medically with schizophrenia, and the treatments are based off of the symptoms that the patient expresses. It is difficult to cure schizophrenia, but medication and therapy can help reduce the symptoms and has the chance to stop the progression of them. It can be caused by many things, such as structural changes in the brain, environment, previous drug use, and genetics. The main cause of one developing schizophrenia is usually through inheritance with a rate of 80%, found in a study by Maud Razali Salih for the Malaysian Journal of Medical Sciences, and which is why it is important to get tested. The earlier one finds out and can start getting treated, the better their symptoms can be controlled. However, there are some downsides to getting tested: struggling to find employment or health insurance, anxiety over the future possibilities of developing the disease, and the chances of being misdiagnosed are all things that may keep people from getting the test, and why many people believe genetic tests in the workplace are wrong, such as Crum in his article over why Congress should ban them in the workplace altogether. As before, if one were to test positive, there is no specific cure, but there are ways to manage the symptoms. The S&P test would include 10,000 genetic variations to account for all S&Ps that show a risk. S&P RS 4129148 has a risk allele C, which can increase someone's risk of schizophrenia by 3 times, and S&P RS 11400240 has a risk allele A, and is the most common gene associated with schizophrenia with an increase in chance of 1.67 times. It is up to the individual to determine whether or not to get tested, but schizophrenia is a serious disease, and if there is a risk, the earlier the treatment starts, the better.